No objection?
Okay. So should we start? Delegate Chang or Miss Young Smith?
Yes, let's get started. It's after what? It's almost 8:10.
Yeah. Okay, so I will open this final presentation and the meeting. So first, I want to thank you everyone for your time last Friday to come to Annapolis. I really hope you enjoyed the trip and enjoyed the program there. And it's something we have been improving ourselves as well. We want to hear from you, what you want us to change or what you feel is good part of that as well. So I really appreciate Delegate Chang and Miss Young Smith are helping. I think overall we hear a lot of good feedback on that. At the same time, we want to hear from you as well. So in case you have other feedback, please let us know. And so tonight will be the last virtual meeting we're going to have for this local 2025 summer internship with Delegate Chang and myself. I really appreciate the time you have been with us. And I know sometimes the task may be not clear. Sometimes we don't meet enough. But at the same time, I looked at your report, actually looks great. I really appreciate it. You put your time and work with the team members. I know in summer sometimes it's a little challenging to meet your team members, but you got it working and you got a report ready. So tonight, we're looking forward to your report. And so each team, you are getting 10 minutes for presentation, and then Delegate Chang, Mr. Young Smith, and myself may ask some questions. So, Dr. Chang, do you have anything to say before the start?
Thank you very much, Doug and Wu, and thank you very much, Ms. Smith, and to all the interns. It's been a great summer. Really appreciate the opportunity to be able to work with each of you and also to meet with you all at the Patapsco State Park ceremony, and also for those who made it to Annapolis and all the virtual meetings and all the other contacts. And excited about what the future holds for each and every one of you. Over the past 11 years, it's been a great joy to work with the different cohorts throughout the years and really looking at where they were before and now where they are 11 years later. It's exciting to see where many of the students who were once where you all are at right now, what they're doing with their lives. So I'm really excited to see what happens in the future for each and every one of you. Each of you are talented. You got a lot of great passion, and we're really proud of you. And we all share a diaspora that really bonds us all together, and it's really important for the different areas of our country and our state to continue to be represented by individuals who represent the diverse communities. I think that, I know that the internship that each of you went through this year and all the knowledge and the skills and relationships that you built, it's actually really important because what as far as how state government operates is more than what the average person, Marylander, knows. So there's about 6.5 million Marylanders in the state of Maryland, and this group right here knows more than 99.9% of the state does. And I think that really helps with civic engagement and also with understanding representative democracy and how each of us can be part of that. And each of us can be part of that during our formative years or whatever seasons of life we're in. But there'll be a new chapter in life one day, and there'll be new seasons in life, and each of you will, you're the future of this state, this country, and the communities. So I know that it gives me great hope to see what future lies ahead, and that, whether it be in the different professions or the industries or wherever life may lead you, really feel confident that it gives a lot of hope for brighter days ahead. It's tough out there in this world. There's a lot of negativity, a lot of things that are not going so well. Yet this program is really a shining light in a dark world. So I really want to appreciate Mrs. Young Smith's tireless efforts over the more than a decade with this program. And this with Dr. Wu, it's been a great honor to be your partner in this program, and each and every one of you. Thank you so much.
Thank you, Dr. Chang. Mr. Young Smith, do you want to say anything before they start?
Well, I wanted to thank everyone, especially Delegate Chang and Delegate Chow, and for such a kind words. But for me as a LOKA, every year is different with the different interns. But every year we're getting better at it. So with all your feedback and talking to us how we can do better for next year for next interns, that's going to be a very helpful. But I personally can tell every year, each year has been changing for better. So. And then also for me personally, getting to know you, each one of you, meeting more often in person and then also through Zoom, I feel like I have much more getting to know knowing you. I know last year I wasn't able to be involved as actively because I was out of the state, and this year I was fully engaged with you. So next year I think I'm much better. I guess in terms of how we can do better. We are doing really good, but we still wanted to have some room for improvement. So thank you, interns. I look forward to seeing all of you on the August 15th for the completion ceremony. And then the lastly is to make sure that you guys submit the essays, final essays for the internship. So thank you.
Thank you, Ms. Young Smith. So let's go to the first group, and the team leader Yan Yun and the team members Jelly Yi, Daniel Jiang, and Sharon Cho. So Yan Yun, you can go ahead, share your screen and make your case.
Yeah, sure. Yeah, sure. Thank you.
I will set a timer for 10 minutes to make sure.
Oh, yeah. Thank you. I'll do that as well. So, like I mentioned before, two of our teammates are not here, but I'll be taking over what Jalen wrote, and Daniel will be doing Sharon's part. Okay, does it look good?
Yeah.
All right. Well, we're Group 1, and we took the Education, or Part L section of the 90-day report. So first, for a general overview or an executive summary of Part L, we found that there were three main things that our 25-page section centered on. First, it was some budget adjustments, particularly in addition to Bill 504, which Daniel will get to later. We saw there were some higher education cuts and some significant financial aid increases. Second, we saw a focus on recruitment and training of our state's educator workforces. And lastly, we saw a plethora of community-focused bills that were focused on enhancing student support systems and school safety, increasing county functions, and amongst the counties, increasing student member of the board or small privileges. So here's a graph of just higher education, and some of the higher education cuts that we were mentioning was, if you look in line 1, row 1, you'll see that the University System of Maryland's overall budget was cut nearly 6.4%. And in terms of financial aid, down here on the student financial aid row, on the last row, there was a $16 million increase, and we thought those were very significant. And in terms of miscellaneous community bills, we found a lot of them were really beneficial to student community. One of them was a bill tackling absenteeism in schools. Another was making a committee to study how to better detect deadly weapons. And amongst others, there were a lot more. Equal pay for high school sports officials is one that tackled on better regulation of Title IX compliances. A public ethics law compliance bill was introduced so that counties had to report that they were complying with the state ethics. And the last two, the Hungry Free Campus Grant Program and the Pregnant and Parenting Students Act, were acts mandated by the state on university campuses that would better student life.
So for my report, I decided to do research on specifically House Bill number 1207, and it basically updates the compensation procedures for student board of members, specifically in Montgomery County, by altering the existing scholarship-only model into a flexible stipend and scholarship system. So in the prior policy, students were only allowed to earn a scholarship at the end of their one-year term, as there's only as the Board of Education consists of one student member and 7 elected members. But with this bill, students are now given the option to receive that total scholarship compensation amount and divide it into stable portions that are distributed into monthly salaries during their term, while also getting the remaining amount at the end of their term as the scholarship in the original policy. And in addition, the bill also updates some of the reimbursement procedures, as now students are not required to submit expense vouchers for when they have to make out-of-pocket expenses, as long as it's related to official duties as part of the board member. In addition, some of the goals of this bill are that it offers flexibility and equity in how the student board member is compensated related to needs. So as the compensation is divided into monthly stipends, that allows the student to get immediate economic support from the board, which means that it also breaks financial barriers for students that need that income during their service for their own personal needs, which in return, it empowers the students to have more contributions during their term, as it acknowledges their contributions as the same as their elected counterparts. And it also improves administrative processes related to reimbursements, because without the need for expense vouchers, it allows students to focus more on their own duties and responsibilities other than keeping track of their own expenses. In addition, for implementation processes of this bill, there are no fiscal impacts on the county itself, as this doesn't make any changes to the total compensation amount. It only changes how the compensation is distributed and given to the student. And it also takes effect on July 1st, 2025. And in addition, any future raises for board members and their compensation amount must begin only at the start of a new term and not during their term, which also supports a stable income. And in addition, for the compensation amount, the total is still the same as on the side of the right. It states how the total amount has to be remained at the lower of either the highest in-state institution, including fees and dorm costs at any university system, at a university system Maryland schools, which can include Towson University, UMD, College Park, and other local schools, colleges. Or in addition, it can be compensation of a regular board member, which is currently at $25,000.
Okay, so for my bill, I chose campus services, and within that, I chose the Pregnant and Parenting Student Support Act, or Senate Bill 511. And essentially, the purpose of this act was to improve equity and inclusion for pregnant students on University System of Maryland campuses. So in short, the bill mandated that each campus or university made four programs that would help pregnant or parenting students. Those were: one, a referral program for government assistant programs both on and off campus. Second was a referral program for adoption services. Third was the creation of institutional accommodations for those students that would be the same as any other student that was perhaps restricted to the home or any other condition as long as there was a doctor that approved that it was medically necessary. Fourth, they mandated a referral network of healthcare service providers. For a little more detail on what this bill was and who it affected, we first have to go into why it was made. So Title IX, which I'm sure all of you are familiar with, was a federal regulation set up in 1972 as part of the Education Amendments. And essentially what it said was that all federal institutions, or all institutions that received federal funding, are prohibited from discriminating on the basis of sex. And since pregnancy, childbirth, and the consequent caregiving, if chosen, are all very closely related to a student's sex, they are therefore covered under Title IX. On this law, all University System of Maryland institutions are covered under it. But however, there are a couple of colleges that are exempted, namely the University of Maryland Center for Environmental Studies, the University of Maryland Global Campus, and the University of Baltimore. Well, and upon our research, while we searched for reasons as to why these campuses were particularly exempted, we couldn't quite find them. But it's our speculation that perhaps it was due to their campus models, since the University of Maryland Global Campus primarily functions online. And this law is implemented on July 1st, 2025.
For this research on House Bill 504, it specifically targets improving the educational experience through what is known as the blueprint for Maryland's future legislation, which is a 10-year educational reform plan. And its main goals is to provide more flexibility within local school systems while also strengthening the roles for teachers and developing their abilities, while also planning for future of local schools. And the bill plans to achieve these goals by also delaying the implementation of certain programs, which I'll talk about in the next slide, and also altering the per pupil fundings, which is basically fundings for individual students given at a school. And in addition, and finally, it also expands long-term funding plans, which will also be in the next slide. So some of the specific changes that the bill makes is that it delays collaborative time, which is basically a specified program that provides teachers a specific time frame in their schedule to work with other teachers and students to further improve the learning experience for their school. And it's also stated that the 163 funding per student for collaborative time, which is supposed to be used for the original collaborative time implementation, can now be flexibly used for anything, for any purpose, not just the specified collaborative time, which also improves flexibility. It also strongly supports educators with several new implemented programs, such as academic leadership programs, Maryland Leadership Program, Grow Your Own Educators Grant Program, Career Counseling, Maryland Teacher Relocation Incentive Grant, and the National Teacher Recruitment Campaign, which all focus on recruiting new, well-trained teachers while also improving their capabilities. In addition, the total amount of money in the annual budget of the Accountability Implementation Bureau is an independent unit of Maryland's government established to ensure that the implementation of the blueprint for Maryland's future is certified by the governor and General Assembly members. In addition, the Maryland Board of Education is also stated to lead a new special education funding program, which is later in the year. And in addition, in fiscal year 2026, the Board of Education will also assist local school systems for the development of new improved models for teacher collaboration with students. And lastly, the bill also implements the use of digital AI tools during instruction time, which can further improve effective efficiency during class time.
Okay, now for Jalen's, she chose to do Senate Bill 813, and pretty much it was a bill on the Board of Community College Trustees for Howard County. Its three primary goals were improving transparency and public involvement, strengthening board accountability and training, And lastly, supporting the faculty and the staff through better communication and feedback. Now, these goals were addressed a couple different ways, which I'll address in the next slide, but pretty much they added more members to the board. They required time for public comment on every single meeting, and they required that all meetings were posted online. Third, they made board members complete governance training at least every 2 years, and they also made yearly employee satisfaction surveys that should be released to the public, given that sensitive information was redacted. And lastly, it required county boards to submit updates to the General Assembly every 6 months on the progress of the faculty union contract, starting in fiscal year 2026 and continuing until the contract was finalized. Now for some details, in terms of board membership, Senate Bill 813 mandated that the Board of Trustees for Howard Community College increase from 7 members to 9 members. And in line with prior law, where of the 7 members, 6 of them must have been Howard County residents, on the modified bill, similarly, out of the 9 total members, it requires that 8 of them are also Howard County residents. For the 2 additional members that are added by this bill, their term limits are set to expire in 2032 and 2033. For the faculty union reporting requirement, it begins on January 1st, 2026, and the board must submit biannual reports to the Maryland General Assembly on the status of those contract negotiations. And finally, for the implementation and for their physical impact, the implementation of Senate Bill 813 in terms of the Board of Trustees takes effect on June 1st, 2025. It has minimal impact on state finances, and although the Howard Community College may incur minimal costs for recording meetings and conducting surveys, we believe that and training and reporting requirements can be met mostly with the existing resources. And just to sum up, there will be a minimal effect on Howard County revenues and expenditures, and they are to be considered a local government mandate. Thank you. That is all we have for our presentation.
Thank you, Ian and Daniel, for taking the lead to cover your team members. Great job, Robo. Can you take off the sharing? Yeah, stop sharing. So I think overall great presentation, or you kind of exceed the 10 minutes timeline. So I think for one, always in the future, remember put a slide number in your slides. So then when people come back to reference your slide, it will be easier to figure it out, right? As to which slide I'm referring. So some slides you have too many text. That's the problem, right? If you got full text on your slides, it's challenging to read it or to really try to capture what they're trying to say. Post the most important one on your slides. And overall, it's great. So I have one question for the first bill, HB 1207 from Isabel Daniel, right? I think there's so many high school students here. You know, in Maryland, every county you have SMOB, right? Student board members. Any one of you actually think about running for SMOB? I know it's out of the bill itself, right? Any one of you think about running for SMOB? Raise your hand, right? No? If not, right, think about it. It's a very important role. You will make policies for your whole school system, either Montgomery County or Howard County or other counties, right? And it's a leadership position. You have a huge impact in your school budget, in school operation, and you have leadership role to really shape how your school should be run by the superintendent. So I hope some of you may think about it for the next year. That is a great opportunity, and just get engaged and be the leader in the community. And I think that's my question for this presentation. Delegate Chang, do you have any questions for the presentation?
Great job to the entire team. I really appreciate Ian's focus on the pregnant college students. I think that's important to identify and also show compassion towards that segment of population there to help students who are in that position and life experience. I really appreciate that and the kindness and the compassion that comes along with that. And then as we've seen through the presentation that the higher education rates are really being affected with the increase. And I think that that's definitely something pertinent to this group here as, you know, many of the students are looking towards higher education and education after their high school careers. So that's something to continue to monitor, and that's why it was mentioned earlier that this group of students really has a forward look and also a really in-depth look on what's going on in the state of Maryland, specifically with the different segments, and in this part with education. And then overall, it was great to see the different topics within education cover, the higher ed to the K through 12 to the composition of the community colleges and also the student member board. So great job, everyone.
Thank you, Dr. Chang.
Thank
If Young Smith, do you have any questions or feedback?
Oh, no, I don't have any questions. I just think that you guys have done a great job as a teamwork. And then Delegate Chow, you mentioned about the student board. I think that would be really good for anyone that be more involved. I think it's
Anyone, if you are thinking about running this, right, or even
yeah.
remotely think about it, talk to us. We want to help you, right? Get involved, tell you how to run it, and I think that would be a very strong sentiment for the community as well, right? We want leaders to come from the community, from our interns, and that's involvement, running for election, serving on the school board will be something very prestigious and really show the impact.
Right.
Okay, so great job, team 1. Let's move to team 2. So tax and team lead William Kim, team members Ashley Kim, Esther Han, Matthew Bay. Please go ahead, share your slides and present. Who is going to share the slide? William.
Oh, wait, I'm on my phone.
All right, do you want me to share it?
Do you have other team member who have the slide to share?
Yeah, I can share it.
Okay.
And then Esther Han, we couldn't get her contact. So
Oh yeah, I contacted her because I didn't know where else to contact her, and she didn't really respond to my email. And I shot her another email a while ago, but she hasn't responded to that yet. It's been like a week or two.
Okay, go ahead with what you have. Thank you.
and then Ashley Kim couldn't make it. So all right. 2025 Maryland legislation, affordable housing, property tax relief, and clean energy. By Matthew Beck, Ashley Kim, and William Key, presented on August 8, 2025. Content overview. Number 1, Matthew Beck, Affordable Housing Incentives in Senate Bill 327 and House Bill 390. Number 2, Ashley Kim, Property Tax, Payment Plans, Notice to Taxpayers. Number 3, William Key, Solar Energy Generating Systems. Affordable Housing Incentives in Senate Bill 327 and House Bill 390. Introduced and read first time on January 16, 2025 by Delegates Corman, Fair, Palakovich, Carr, and Stewart. I chose House Bill 390 because affordable housing is a rising issue affecting many communities, especially as housing costs continue to rise. This bill finds a middle ground between supporting developers and protecting low-income residents. It offers a practical long-term solution without requiring large-scale government spending, and instead empowering local governments to act based on community needs. House Bill 390 addresses the rising cost of housing in Maryland by creating local level incentives for developers to include affordable housing units. As housing shortages grow, especially for low-income residents, this bill creates a sustainable strategy that supports both the community and the housing market. By using practical tools like tax agreements instead of relying on large-scale government funding, House Bill 390 empowers counties to directly support affordable housing efforts in ways that reflect their own local needs. Key provisions. House Bill 390 allows counties to offer pilot agreements, which are payments in lieu of taxes, giving tax breaks to developers who set aside at least 25% of their units for affordable housing for a minimum of 15 years. Counties can also require more than 25% based on local needs. Fiscal impact. Because the bill encourages local tax incentives rather than new state funding, It has minimal direct fiscal impact on the state budget. It promotes affordable housing through tax flexibility rather than additional public spending. Concerns and challenges. Some counties may face reduced short-term tax revenues under pilot agreements. There may also be concerns about enforcement, equity and developer participation, or whether the incentives are enough to meet urgent housing demands in high-cost areas. Ashley Kim, Property Tax Payment Plans Notice to Taxpayers. As a high school Asian American student, I chose House Bill 790 because it relates to the struggles many immigrant families face. It can be hard to understand or afford property tax bills, especially with language barriers or tight finances. This bill helps by making monthly payment options clearer through flyers and websites, giving families more time, less stress, and a better chance to keep their homes. It shows how better communication can make a big difference. Maryland House Bill 790 makes sure homeowners know they can pay their property taxes in monthly installments instead of all at once. It requires counties to include flyers with tax bills and post information online that explains how these payment plans work and how to sign up. This helps prevent tax sales, where homes are sold due to unpaid taxes, by making sure people are aware of their options. This bill especially supports seniors and low-income families who may struggle to make a large lump sum payment. A key provision of House Bill 790 is that all mailed property tax bills must include a flyer explaining the option to pay in monthly installments, how the payment plans work, and how to sign up. The same information must also be made available on county and state websites to ensure wider access. House Bill 790 has no fiscal impact on the state, but may cost counties around $500,000 in total to print and mail informational flyers. Despite the cost, the investment is seen as worthwhile to help prevent families from losing their homes. Concerns and challenges. A concern with House Bill 790 is the added cost and effort counties will face to print and distribute flyers, which could be a challenge for local budgets.
Okay, so today I want to discuss House Bill 111, which was a law passed in Maryland in 2024. Its purpose was to increase the use of solar energy in the state, and it caught my attention because it's not only about clean energy, it's about how the policies that we create today shape our future. And so, since I'll be living with those long-term effects, I believe that it was important to consider both the benefits and the challenges. The main goal of this bill is straightforward. It's to make solar energy more affordable and attractive. And it does this by providing property tax exemptions for homeowners and businesses that install solar energy systems, which means that if you put solar panels on your property, you won't have to pay certain property taxes on them. And while this may seem minor for the wealthier, for many people, saving $100 a year could influence their choice between solar and traditional energy. And apparently, on average, homeowners save about $333 per year in property taxes and over $1,300 in sales tax avoidance. I also read about someone whose system cost under 9 grand after incentives and
Chang,
paid itself off in 4.5 years.
you need to flip your slide. Yes.
Oh,
Yeah.
yeah. Oh man, I think that's a pretty smart investment. But however, the bill involves more than just tax breaks. It establishes a task force of experts and community members to study the long-term effects of solar energy in Maryland. They examine its impact on the state budget, the power grid, and low-income communities. The goal is to ensure the growth of solar energy in Maryland benefits the environment while being fair and sustainable for everyone. But like any bill, there are certain trade-offs. A major concern is that cutting property taxes will reduce funding for local governments. Since counties rely on this money to support schools, public safety, and community programs, losing that revenue may lead to problems. Another issue is that despite the tax breaks, solar panels remain expensive. For many low-income families, the upfront cost is too high, which means the benefits of this bill might mostly go to those who can already afford them. Without extra support, the gap between the wealthy and struggling communities could widen. This bill was important to me because I belong to the generation that will live with the energy decisions made today. Although I care about the environment, I also care about fairness, and I believe House Bill 1111 is a step in the right direction. It promotes cleaner energy and lowers some financial barriers. but it does need careful implementation with a strong focus on ensuring all communities can benefit, not just the wealthy. Ultimately, this bill is not just about solar panels, and it's about leading us toward a cleaner, smarter, and more equitable future. And I believe it's something worth supporting.
Thank you for listening. Thank you for your time and attention. We're happy to answer any questions you may have.
Thank you, both Matt and William, for first of all covering Ashley Kim, right? And then I really like the way you have really consistent kind of layout. That's great, right? To show the team and then easy for people to follow. That's kind of overall feedback, right? So the other side, I think like in the future when you do presentations, make sure you have less text, right? Basically, you have too many texts, like text. You can say them clearly, right? You don't need to read them. So when you put on the slides, they kind of overwhelming to your readers. So so overall, you did pretty well. I really appreciate that. I think I have a question for Matt. In terms for the affordable housing, you read a lot, right? So based on your understanding, do you have any ideas? Maybe you think about a better way to create affordable housing?
A better way?
Yeah, or different ways?
Maybe the government could also offer loans. I think they do, don't they? They offer loans to like developers to create more affordable housing units, or do they not? Because I know they can take out business loans.
Yeah, they have loans. Yeah, from the city government. That's true.
So yeah, I mean, other than that, and then the pilot agreements, I'm not really too sure.
Thank you. Yeah. So affordable housing had been a problem for the state, for the county, right? Now housing costs, especially if either people rent or people try to buy a house, it's just so expensive. It's really challenging for young people to really get their first stable housing. And so definitely the state and county and think about how do we provide that support for stable housing for our young people, for everyone in the state. So I think you three chose a great topics, three great topics, and thank you. Can you turn off the sharing? Yeah, Delegate Chang, do you have any questions, feedback, comments?
A great presentation, everyone, and specifically also with regards to when the presentation talked about the access to housing, especially for the immigrant communities. I think that's really important and it just reminds us of all that immigrants go through and in general to everyone as far as the affordability of housing and then also access and then just understanding the complexities of all the documents that go into whether purchasing a home or rentals or other types of arrangements.
Okay. Ms. Young Smith, do you have any comments or questions?
No questions. It's just the presentation slides were much more interesting, meaning that it gives you more pictures and a little bit each bills was a little bit consistent in terms of format, but I agree with you, Delegate Chow, that it was too wordy. But it's a given taking what do they call it? You had a good pictures showing everything, but it was too wordy. But it was very good presentation. Easy to follow. Thank you.
Thank you, Team 2. Let's move to Team 3 and the public safety. Team lead Chloe Hong. Team members Kathleen Park, Joanna Kim, Joshua Kim. Go ahead. Who is sharing the slides? Okay, good. Go ahead.
Sorry. So this is our 90-day report on public safety by Joanna, Joshua, Chloe, and Caitlin. So I chose to do House Bill 1222, which was on immigration enforcement or the Maryland Values Act. House Bill 1222, which is House Bill 1222 sets specific rules for immigration enforcement at what is called sensitive locations. And this can include public schools, libraries, government-run health facilities, courthouses, shelters, and other state-funded sites. Um, and by October 1st, the Maryland Attorney General must release public guidelines explaining exactly where and how immigration enforcement can happen in these places. One major change is that federal immigration officers have to notify local law enforcement before taking action at these sites. And in addition to that, non-public areas must remain off limits unless there's a federal court warrant or an emergency. And the impacts of this bill are very significant. First, because it helps protect immigrant communities' access to education, shelter, and healthcare without fear of being targeted. It also reduces the fear that can keep people from using many public resources. Um, for schools, libraries, and other agencies, it provides clear protocols for handling federal requests, and overall, it just aims to balance public safety with legal rights, and it just ensures enforcement actions while limiting unnecessary harm.
Okay, I'm going to be talking about State Bill 378, which is called the Family Literacy Pilot Program. The goal of this program is to allow incarcerated parents to record themselves reading children's books aloud and then sending those recordings along with children's books to their kids. The program is administered by the Maryland State Library Agency in partnership with the Department of Public Safety and Correctional Services and the Correctional Education Council. In this program, there are 4 correctional facilities selected across Maryland. At least one has to be male and one female. And in these facilities, both English and non-English books are included, which is really helpful for the immigrant community especially. And in these programs, both the parent and the child do not have to pay for anything. It's completely free. The cost estimate for this program in 2026 is around $69,200. That's for the contractual administrator and the supplies, which includes the books and the recording gear. This program was signed into law by Governor Wes Moore in May of 2025, and it is supposed to run through the end of 2028. I thought this program is really uplifting, and it's a great step towards investing in the future of Maryland and helping unrepresented communities. I think this program not only improves education for these children, but also strengthens family bonds, which is really important. The children get to know that there's someone there looking out for them, and it's also really helpful for the parents because they get reminded of their identity as a caregiver as well. Yeah.
The bill that I chose to research was Maryland Senate Bill 608, or SB 608, which was passed in April of 2025. The bill focuses on like improving access to U non-immigrant status, also known as U visas. And the visas are designed to protect immigrant victims of certain eligible crimes that report injustice to law enforcement. The main goal of SB 608 is to make it easier and safer for immigrants to report crimes committed against them in the future without the fear of being ignored or mistreated because of their immigrant status. The primary changes that the bill brought were number one, faster response times, which means that the overseeing certifying agencies now are required to follow stricter deadlines for responding to U visa certification requests. The deadlines depend on the status of the petitioner, which means that for standard applications, the time changes from 90 days to 45 days. And for potential deportation cases, it changes from 14 days to 7 days. Number two, language access requirements. The same certifying agencies now are legally required to support individuals in need of translation. That this helps ensure that like language barriers and lack of English proficiency don't prevent people from seeking protection. And the last one is expanded eligibility, which means that the bill expands upon who can apply for U visa certification on behalf of the victim. This is really important in the cases where the victim is unable to apply for themselves, such as in instances where they're minors or people that are incapacitated because of the crime committed against them. So in summary, I think that SB 608 is like a major step forward in protecting immigrant communities here in America and ensuring that they receive fair and equal treatment under the law.
I'll be going over House Bill 293, which modifies the criminal procedure regarding child victims in child abuse cases. The House Bill 293 was introduced on January 9th, 2025, and after its hearings, it was passed unanimously in both houses of the legislature and sent to, at the time, Governor Wes Moore. And through that, the governor signed the bill and it became law on April 22nd of 2025. The bill's main focus was to reinforce the safety of young abuse victims in court. The bill allowed for victims to stay away from their offender and ease their mind. This was important to them as their testimonies were crucial in the court, and being in the same vicinity as the offender may potentially influence them to lie or not clearly speak. The bill did make it so that the testimonies had to be given through CCTV inside the courthouse, but overall, its main focus was to separate them from the offender. Its main impacts were to create a less timid environment for victims, and it motivated them to give accurate testimonies with clear minds. It removed potential causes of mental and physical harm for the victim, and it protected their well-being. It encouraged other changes in legislative environments to become more considerate of people's well-beings. By this, I mean that the bill became a frontier as it started focusing on people's minds and physical health rather than focusing on the only at the trial from the past. It's important to realize that victims also still feel the impacts of whatever they felt, especially in abuse cases and for children who are so young. The public was very supportive of this bill, and their main support for the bill was the fact that it would change and benefit future court cases, and it would reduce like psychological impairments for the children. Critics did say that they were worried about the actions and words of the victims to not be easily read, as in person you can tell through their actions if they're lying, through their shaking or like hesitant words. Personally, I believe that I'm in support of this bill, and I hope that it helps more future victims to feel safer when they're trying to give their testimony. And I feel that the critics were a little bit unfair with their criticism, as the actions of the children who may be hesitant in their speaking or trembling with their actions or fidgeting could all just be due to being nervous being in a courtroom, as it's a very serious environment. I mainly chose this bill as I feel that in order to be successful as you're older, you should have a good upbringing, and happiness should be the focus of when they're younger. So, thank you.
Thank you. That's it.
Thank you. Yeah, thank you very much. I think it's kind of interesting, right? For the public safety, I feel either your immigration enforcement bill or talk about the incarcerated parents reading to the children, or about the non-EU immigration status, right? Or child victim testimony. Everything kind of related to humanity, I would say. Be humane. deal with different challenging situations. I think some of you may heard recently that the Korean American student at Purdue, right, was arrested by ICE. Even she didn't really commit a crime. And it's really unsettling situation for a lot of people in this country. We just can't really, really disappointed the way the federal government is doing. And I hope things will change quickly over time. And so one question for I think there are four, right? I just try to ask two questions for two students here. For the first bill, immigration enforcement, and we try to say when they're in like sensitive location, they need to be more careful. So how do you feel where that sensitive location will be expanded or actually will be limited? What's your opinion on that?
Wait, I'm sorry. Can you repeat the question?
So for the first HB 11212, right? You talk about immigration enforcement. So that for sensitive locations and the enforcement need to be careful, right? And so beyond the locations mentioned, do you think any other location may be included?
I don't think so.
Mhm.
I think that like sensitive locations are like very important though because if people are like afraid to like go to like their school or library or like health clinic, like they might be like targeted and like I think that that's what this bill is trying to prevent.
Mhm.
That makes sense.
Yeah, thank you. So Chloe, so then another question for the last bill for Joanna. Actually, I like the way you even cover some opposition side opinion, right? That's really important because whenever you have something, in most cases, you will have a two-side opinion. So by covering that side, it will be helpful for people who try to understand the complication of the issue. Really appreciate that. So one question for you, and since you said you supported this bill, right? So what other situation you may think we should expand this protection maybe to different groups, maybe any other group you feel will be helpful for them to testify virtually?
I think that this can also correlate to like the education section. So for students who want to speak their opinion but are afraid of potentially getting backlash for what they feel is right, I think that there could be potentially more a new system or potentially like more modifications to make them feel safer. Although I did talk about how victims have felt, I think that this could be applied to actions in the moment as well to prevent any future harm too.
Thank you. So Delegate Chang, do you have any comments, questions?
Great job, everyone. I think that really highlights the different situations that different immigrant communities can be encountered with public safety. So I think that really appreciate the highlighting of this issue. Thanks.
Mr. Young Smith, do you have any comments or questions?
Oh, no comment, no questions.
Okay, thank you
Yeah.
very much for this group. Did a great job. Really appreciate that. Let's move to the last group tonight, Health and Human Services. Team lead, Breeze Kim. Team members, Catherine Park, Lucy Lee, Evelyn Park, Yu Shin, Jennifer Shin, Jalen Park. Please go ahead.
Yeah, before we start, I had a question about like the 10-minute thing. Like we have 7 people in
Yeah,
our group.
you can take a longer, yeah.
Okay, yeah, thank you. I'm gonna try to figure out this.
Thanks for asking. That's very important, right?
Okay, I don't think I can really share my screen. So if anyone in my group can do it, that'd be helpful.
Anyone from Team 4 can share your slides?
I'm on my phone, so I can't really do it.
Anybody else?
Yeah, I can do it.
Okay, please.
Okay. So we're Group J, which is based on Health and Human Services. Oh, wait a second. Okay. So my name is Breeze, and our group has Catherine, Jalen, Evelyn, Lucy, Jennifer, and you. Okay, so these are all the bills that each one of us chose, and I'm not going to read them all out right now, but we're going to be elaborating on them as we go. So we're going to be starting with House Bill 1086, which is my bill. Okay, so for a quick outline of this bill, it's addressed under Section J of the 90-day legislative report, and the main purpose of this bill is to outline the mandated coverage of anesthesia for patients undergoing medical procedures. And some people may wonder, why is this bill important? Well, it ensures public safety, comfort, and recovery by preventing any disruptions in anesthesia while the patient is undergoing their surgery. And a really big part of this bill is that insurance companies cannot set time limitations on how long the anesthesia is covered. And it also removes restrictive insurance practices that may jeopardize the patient's care. And it reinforces healthcare as a human right by prioritizing access and safety. This bill is really important because it protects patients during their vulnerable medical moments. Now, like I mentioned earlier, insurance companies can't set time limitations on the covered anesthesia. And this applies to managed care organizations, nonprofit health service plans, and health maintenance organizations. Okay, so I'm going to be going into a little about like how the bill was actually made. And the primary sponsor for this bill is the Shanti Martinez, and there were there was a whole list of bipartisan supporters that I couldn't list on this slide, but this was committee reviewed by the House Health and Government Operations Committee. And there were two key amendments of this bill, both under file 893229/01. Okay, so the first amendment that was adopted was actually named Amendment Number 2, and this requires that anesthesia be covered before and after procedure. I mentioned earlier that the anesthesia needs to be covered during the ongoing process, but this amendment makes it so that the anesthesia coverage be mandated for the whole process, so to ensure the patient's utmost safety. And the second amendment that was adopted, named Amendment Number 1, this expanded the sponsor list to reflect a growing support. Like I said, the bipartisan supporters. The date that this amendment was adopted was on March 12th, 2025, and it was passed from both House and Senate chambers, and this bill will be going into effect January 1st, 2026. So, the reason that I chose this bill was first because I want to be an anesthesiologist when I grow up, but also because this bill is extremely important to patient care and it protects those who are in vulnerable situations. A big reason for this is that it ensures continuous and safe anesthesia coverage and contributes to growth of healthcare access equity.
Okay, so I'm Catherine, and I had House Bill 424. And for the background, it's also known as the Lowering Prescription Drug Costs for All Marylanders Now Act, which allows the Prescription Drug Affordability Board, also known as the PDAB, to set upward payment limits on drugs and prescriptions. Key problems like that made this House bill like pass was that Maryland struggled to afford prescription medications that get more expensive every year, and for poorer people, that forces people to choose between their health and other necessities like food or like clothing or housing. And the purpose and importance of this bill is it allows Marylanders to afford healthcare easier, and it protects Marylanders from drug shortages. And the government also earns support by Marylanders because of their transparency and how they set UPLs. And then criteria for an upper payment limit. Like they look at the cost of administering the prescription drug products and the cost of delivering the prescription drug products to customers, as well as the effect of the upper payment limits on providers of the 340B prescription drug products, because this falls under the Medicare Plan B. And then the process for setting upper payment limits is they monitor availability of any prescription drug product which may require a UPL, and they reconsider or suspend UPLs on prescription drug products that have a shortage of that product. And they also prohibit application of a UPL for a prescription drug product that is on the shortage list. Normal Marylanders are affected because they get to, like, they have lower out-of-pocket costs, which means they have to pay less out of their own pocket, and they have increased access to healthcare. But for pharmaceutical companies, they may like not be as on board with the bill as like a normal Marylanders are, because they receive reduced revenue and price control drugs. And this bill is going into effect on October 1st, 2025. And although I didn't write it within my slide, I chose this bill because I believe this is like an important step for everyone to have equal access to healthcare, and so that the wealthy cannot like monopolize like all the drugs. And so poor people will have more access to them.
Okay, so the bill I chose to research is House Bill 1083, and this bill focuses on improving mental and behavioral health care in Maryland, especially for children, young adults, and people with complex developmental or behavioral needs. This bill is to make healthcare more effective and fair, since many kids in Maryland don't get mental health help early enough. And this bill helps address that by making the system stronger. Two key groups that are assigned to lead this effort are the Behavioral Health Advisory Council and the Commission on Behavioral Health Care Treatment and Access. These groups are required to study the current system and come up with a plan for better care. And that plan must follow EPSDT guidelines, which is a national Medicaid standard that ensures children get regular checkups, tests, and treatment. Under this bill, the council and commission have to create a statewide plan to improve behavioral health services, and that plan must be submitted to the General Assembly by January 1st, 2026. And the goal is to improve screening, diagnosis, access to treatment, and service gaps, especially in unserved areas. And overall, I think this bill is important because it makes sure that every child, especially those who are often overlooked, gets the care and support they need.
So the bill I chose was Senate Bill 848 and House Bill 930. And together they create the Public Health Abortion Grant Program within the Maryland Department of Health. These bills were introduced by Senator Ariana B. Kelly, who is a prominent leader in health legislation. The goal is to ensure that abortion care is accessible to everyone, regardless of income or location. So after the rollback of Roe v. Wade, Maryland saw an increase in out-of-state patients seeking abortion care, and this bill is Maryland's response to that growing need. It doesn't only like protect access, but it invests in like the structure that supports it. So the program will distribute state-funded grants to providers that offer abortion services, and this funding can be used to upgrade clinics, hire and train more medical professionals, and run outreach programs to connect patients with care. What's most powerful about this legislation is that it goes beyond like short term, and it focuses more on like a permanent and reliable fund that makes sure that Maryland can meet like the demand and stay ahead of like a lot of the game within reproductive rights. And in short, this bill is about equity, readiness, and compassion, and Maryland's position as a leader in reproductive freedom.
I focus on House Bill 384, and this bill established the Maryland Disability Service Animal Program led by the Maryland Department of Disabilities. And this program is designed to help those with disabilities perform tasks Reason why this bill is important is because it provides trained service animals to help individuals with disabilities improve safety and independence. It reinforces Maryland's commitment to disability rights and inclusion, and also builds strong partnership with nonprofit training organizations. Some key program conditions are that the Maryland Department of Disabilities has to choose at least one nonprofit organization to train and provide service animals to individuals who are disabled. And only Maryland residents with disabilities are allowed to join this program. The Maryland Department of Disabilities must ensure that they have enough staffing by October 1st, 2026, or else the program can't be continued. And the state must provide $25,000 every year to cover the expenses for training, operations, and other necessary costs. Reasons why I chose this bill is because it supports people with disabilities who need help with everyday tasks and medical needs. It gives individuals more safety, freedom, and independence through service animals. And lastly, it makes sure the program is planned well and it has proper staffing and funding.
I choose to talk about Senate Bill 223 and House Bill 158 because it addresses something that's becoming a bigger challenge in Maryland, which is senior isolation. So, social isolation isn't just feeling lonely, but it can increase the risk of dementia, cause people to miss medical care, delay emergency responses, and lead to mental health decline. So before this bill, the Maryland Department of Aging had the Senior Call Check Service, which made daily automated calls to residents aged 65 and older to check on their well-beings. But this year, the lawmakers decided to expand on the original Senior Call Check program and give it a stronger purpose. The Senate Bill 223 and House Bill 158 rename and grow the service into the Senior Call Check and Social Connections program. So, can you go back to the slide? So this law authorizes NDOA to broaden outreach by integrating direct scheduled communication via phones, text, video, or in-person check-ins, and emergency response if participants do not answer, and community partnerships with nonprofits, agencies, and villages, and telecommunications access of Maryland services for accessibility. So the new law gives the Maryland Department of Aging the ability to promote social engagement and emotional wellness, prevent health and safety emergencies among isolated seniors, ensure equitable access to connection and support, and lastly, strengthen interagency collaboration across countries. This bill matters because it ensures equitable access for seniors facing technological, languages, and sensory barriers. And it personally matters to me because through my volunteer work with elderly people, I've seen how a simple phone call or a tech lesson can brighten someone's day and strengthen their sense of connection. The values behind this legislation, which is dignity, safety, and human connection, really aligns with what I've learned through direct community engagement.
So I'll be presenting the House Bill 1004 and Senate Bill 748, which focuses on expanding public health information for Alzheimer's diseases and related dementias. This bill was passed to ensure that accurate, up-to-date medical information, especially about FDA-approved treatments, is available not just to doctors and caregivers, but also to the general public. The Maryland Department of Health is now required to collaborate with organizations like the Alzheimer's Association, the Department of Aging, and the Virginia I. Jones Alzheimer's Disease and Related Disorders Council. Together, they will maintain an online platform that's updated every year, featuring downloadable and easy to understand resources for both professionals and families. The legislation also ensures that healthcare providers receive current educational materials to guide early diagnosis and better treatment decisions. And these steps are designed to improve access to care and reduce the delay between symptom onset and proper treatment. What makes this bill so important is that it addresses a common reality that many families simply aren't aware that effective treatment exists or that they are eligible for them. This legislation helps close that gap, moving Alzheimer's care in Maryland towards a more informed, accessible, and proactive approach. Next slide, please. So I chose this bill because I have personally seen the impact that delayed or inaccessible information can have, both through my own research in neurodegenerative diseases and through the stories I've shared by families affected by Alzheimer's. And isn't just a medical condition. It's also an emotional, logistical, and financial burden. And a significant part of this burden comes from not knowing where to turn or even the options exist. This makes the bill as meaningful because it puts real evidence-based guidance directly into people's hands. What stood out to me was it focused on equity, ensuring that underserved communities have the same access to clear, understandable resources as anyone else. It's about making sure information reaches those who need it most, regardless of their background or circumstances. And I believe this legislation will have a lasting impact by strengthening the bridge between scientific progress and real-world patient care. It encourages early intervention, improves outcomes, and fosters a more compassionate system for aging individuals and their families. And then it's about giving people knowledge, and with that knowledge, the power to act sooner and live better. Thank you.
Please turn off the sharing. Yeah. Thank you. Great job, team. You made it. I just want to go over and do a recapture. I think for the first one, Breeze, you did a great job to talk about the anesthesia coverage, right? And there's no timing for that, right? So by asking insurance not doing time limits, that would be extremely helpful. I think the other part I really appreciate, you actually talk about amendment. So because most people didn't really highlight the importance of amendment, because amendment make a changes to the original bill. So there are two parts of amendment. One is the amendment comes with the committee. Then on the floor, there may be amendment comes again. So there are two opportunities for the bill to have amendment. So just highlight that. Great job. And Catherine, I think you talk about the upper limit for some prescription drugs. That's very important. Jalen, you talk about improve mental health, behavior healthcare. It's critically important to a lot of families. And Evelyn, you talk about support for abortion, right? It's barely, nobody really expect the Supreme Court turn over the Roe and Wade. And unfortunately it happened. I think Maryland has a strong commitment to support women's rights. So this bill is really show that support. And Lucy talk about a mandated disability service animals program. I think that's important because there's so many people need to service animal in the future. And I think that's a huge support to that program. Jennifer, I think the issue talk about the social co-op check, the social and connection program. So it's critical we keep our seniors healthy by supporting them. The more support they get, the healthier they have. Actually, the return actually for the state is positive. That means we spend less money to support them in terms, right? Because they got less problems. So the last one, Yushin, I think you talk about Alzheimer's support. That's simple, very important because a lot of family probably don't know there's some new drugs may be available for them. So I think by creating a portal to support them and many other support as well, it's really a huge boost to the families. I really appreciate this group. You put all the bill together from different angle. It's a great support, kind of coverage for families to understand what's happening. Hopefully, you're going to talk to your families, said which bill you cover as well, right? Go back, share with them. Maybe a lot of families have no idea of this, right? Talk to your community member, talk to your volunteer groups, talk to any place you say, oh, I learned some bills, right? Do we know any family needs help, right? Or if they don't know, maybe they will know in the future, right? So that's the purpose for part of you get involved, understand what's happening in our General Assembly, and then spread the word. We are try to do the best to really help the people in Maryland. Thank you. Delegate Chang, you have any comments or questions?
Thank you, Dr. Wu. I would say a common observation that was made and really appreciated too is how the different legislations that were presented this evening were personalized to different interests or different family experiences. And I think that's really an example there of how different bills and legislation are formulated, because within the depths of an individual's heart or something that's really important to them, that's where the legislation really gets the momentum and the energy. And I would say that it's going forward on legislation that each of you may want to consider in the future, that's where the driving force really comes from. I think it's what comes from the heart. And so really appreciate the students who really shared and personalized how these different types of legislation were specifically knitted to the inner parts of them.
Thank you, Delegate Chang. Mr. Young Smith, do you have any feedback or questions?
Oh, I just wanted to thank, this is the biggest group, and I wanted to thank the leader, Kim Breeze. I know that you're doing a lot of multitasking, but thank you for coming all together to present it tonight. Thank you. And also, one of the interesting area that I am going to be involved, or LOKA will be involved in Alzheimer's and dementias for the elderly populations that's facing, especially in Howard County. So I will be working with nonprofit or county governments training or workforce for the community care workers, community health care workers, so we can get them trained so that we can be able to help out the understanding the dementia and how we can slow it and have the workforce available for them. So thank you, Yushin, and thank you also, Jennifer, for the elderly aging needs. And again, you guys done a great job and having 7 groups or 7 people in a one group. Great job. Job well done.
Thank you, Ms. Smith. I agree. It's the big group, right? It's not easy to coordinate. Great job, Breeze, as the team leader, and every team member working with her as well. So really appreciate that. So during your presentation, I was thinking about, because we would choose one group for final presentation during your graduation. I'm thinking about maybe, I know some of you probably can speak some Korean, right? Then we have Korean American, senior Korean American sitting in the audience. Maybe when you do the presentation, maybe have like 30 seconds for your bill using Korean to introduce that. I know that will be a challenge, right? But that's something you can do, right? Think about it, that's a new challenge. And I'll talk with Ms. Young Smith and think about that. But we really appreciate it. The whole night you made the presentation really well presented. And I know you put a lot of effort there. Thank you very much for really and put everything together, has a presentation well prepared and presented pretty well. I think I learned so much as well. And I really appreciate it. This summer, we are working together. I hope you learned something from that. Definitely, I learned a lot from you guys, so really appreciate that. And do I have any other questions? Otherwise, I know we're exceeding time. Okay, Miss Kim, Joshua Kim, go ahead.
Oh, I had like a personal question like after the meeting.
Sure, yeah. Okay, so you can hang on here. But I just want to close this by saying thank you very much and really appreciate the time tonight. And this closes our presentation and the final virtual meeting for the 2025 local internship program. Thank you very much.
Thank you. Give ourselves a big hands. Ooh, good job.
Good job. Yeah.
I'll see you all on the 15th. Thank you.